The Western Regional Hospital's Accident and Emergency serves hundreds of patients per month, and so for years they've needed a bigger space to accommodate patients. And today they have officially received that much-needed expansion, which will help to alleviate congestion and better serve patients.
We are going from 4 observation beds to 8 total, with an additional isolation room, which probably could at any moment house 2 more patients. So it's a huge expansion to our services, definitely.
Now, in terms of the difference it will make, perhaps just express to us, how it will have, the kind of impact it will have.
Well, the purpose of all of this is our patients and the Belizean populace at large. So we're trying to streamline the services, have it given at a timely fashion and a professional fashion, and make it more meaningful for them. So it definitely comes, with added space, you have more to work with and a better environment.
In 3 months, over 150 officers killed in carpentry, plumbing, and electrical work of the U.S. Army South worked on rotation along with BDF personnel on this A&E expansion project, as well as a new entrance and expanded parking lot for better patient experience. It was all done under the Beyond the Horizon project.
This is a pretty basic layout. You have a storage room there, 3 bathrooms down this wall, and then an isolation room on the end. It'll have the capacity to have 4 beds over there and then 1 additional isolation room, so 5 beds total. This building is built for Cat 1 hurricanes, which means it could be picked up and put right on the coast and it would survive a hurricane.
The Beyond the Horizon team, our U.S. servicemen and women, and the BDF, as you already heard, refurbished the children's playground, literally raised the roof on the gazebo and reconstructed it, welded and installed railings for the special needs ramp and also for the stairways, painted the flagpole and a parking curb to reserve parking for patients with special needs, and artists from the last rotation designed and painted murals in a new space for children.
The hospital also received its own medical incinerator, which means the facility will not have to spend an additional $50,000+ per year, as it was doing on a rental unit. Housed in a brand new shed, this incinerator will help with proper disposal of medical waste materials.
That comes to narrow our gaps and to address our infection control and quality control gaps that we have. Since I believe between 7 and 10 years ago, our old incinerator was not functioning, and they used to do open air incinerating with the supervision of our public health. And with all the guidelines attended to, everything was incinerated on an open air basis. Now with this, we take it to another level. And we are going to, everything that is infection control is going to, your needles, your blades, anything that's contaminated with bodily fluids will be incinerated in the compound.
So I know the hospital was, I believe, renting one before, so this is also going to help to cut the cost.
Definitely is going to cost. Cost cutting is coming, and that will help us streamline our budget, definitely.
A second phase of this project will see the old emergency area and the new expansion connected to allow for a better flow of patients. Reporting for News 5, I'm Andrea Polanco.